We've created this video to address the top questions that often come up at first meetings about Scout. Please watch it to the end, so that when you meet with our team, you'll have extra time to discuss the things that are really important to you and your patients when considering a wire-free localization service.
Scout is the only non-radioactive wire-free localization device that generates a clinically insignificant artefact, and we have a number of clinical trials and studies that demonstrate this clearly. What that means for you is that you can place Scout at any point in your patient's treatment journey without making compromises on their imaging requirements. So, for example, if you wanted to place Scout before the patient started their neoadjuvant chemotherapy, you could do that, and they could then have all their staging MRI scans with no impact on the image quality of those. Once they finish their treatment, they can then go straight off for surgery rather than having to go back to radiology for another appointment. So Scout just gives you the opportunity to localise while the lesion is pathological, which is easier than doing it once it's had a response to chemotherapy, and you're not going to have to compromise at any point in their patient journey regarding their imaging requirements.
You can use any imaging modality with Scout. You can also place stereotactically using mammography. You can even use MRI for your neoadjuvant patients because of the clinically insignificant MRI artifact. This means you don't need to compromise your patient's imaging pathway. We've treated over 500,000 patients globally, and many of these have been treated in the axilla. Scout's main body is only 4 millimeters in length. Additionally, offset each other either side is a nitinol antenna, which helps with the low migration rate of less than 1%. What this means for you and for your patient is where you place Scout is where you'll be able to treat the tissue with accuracy. Due to its size and design, it's perfect for the axilla. Does Scout migrate? The short answer is hardly at all. In fact, it has a less than 1% migration rate. One of the reasons is because of the unique design of the reflector, whereby the antennas offset each other, allowing it to work as its own anchor within the tissue. Second reason is the unique design of the delivery system. Unlike other wire-free technology where the marker is pushed out, with Scout it retracts over the reflector, making sure it's precisely placed at the targeted soft tissue.
One of the questions we sometimes get asked by surgeons is regarding the possibility of disabling a reflector or deactivating it by hitting it with electrocautery. The short answer is, it is possible to do this if you directly hit a reflector with your electrocautery, but it's really unusual. If we do see it, which isn't very often, it tends to be surgeons who are just starting out with the technology and getting used to it and are on that initial learning curve. There are a number of techniques we recommend to avoid this. The first one is to place an orientation stitch over the reflector when you get in the cavity, and that just gives you a visual representation of where the reflector is at all times. The second, and most important, is to use your handpiece frequently. We recommend at least 5 times during a procedure, and that just gives you a constant update on where the reflector is as things move when you cut through the tissues that are surrounding the lesion. If you do happen to hit your reflector and deactivate it, not the end of the world, you're not going to be blind. It basically just means you're exactly where you need to be. And at that point, you'll probably be able to actually see the reflector or even feel it with your fingers. So you're still going to know exactly where you are relative to the lesion.
Scout provides excellent precision for bracketing procedures, and the key is spacing. Scout reflectors only need to be placed 1.5 centimeters apart. And why is this important? Scout's close bracketing proximity allows you to accurately mark multifocal lesions that are close together, facilitating more breast-conserving surgery. Additionally, Scout enables you to bracket larger lesions with multiple reflectors. With Scout, you can mark all lesions with precision, providing personalized treatment for your patients. Scout is licensed as a biopsy site marker and also a tissue localization device. So what does this mean for you and for your patient?
it means that the patient can have SCOUT placed anytime prior to neoadjuvant chemotherapy, even at time of biopsy, and then the patient can move straight onto chemotherapy and then onto surgery without presenting to the hospital for any additional procedures. Additionally, SCOUT's clinically insignificant MRI artifact allows you to assess the pathological response to neoadjuvant chemotherapy. Therefore, you've got no compromise on your MRI imaging and your patient pathway.
We're often asked, is there an optimal time to remove SCOUT post-placement? The simple answer is no, there is no optimal time. SCOUT can be removed at any time. The reason for this is that it is not only a localization device, SCOUT is licensed as a biopsy site marker, which means that we can place within soft tissue indefinitely. So whether we're placing at time of biopsy, prior to neoadjuvant chemotherapy, or even an hour before surgery, there is literally no compromise for the patient pathway. As SCOUT is completely inert within the body and has a documented migration rate of less than 1%, this means that clinical teams can offer their patients personalised treatment plans without compromise.
The device we know today as SCOUT was once called SavvySCOUT. It was developed by a company called Cianna, who also have another product called SavvyBrachy. To avoid any mix-up or confusion, the decision was made to change the name from SavvySCOUT to SCOUT. This was in 2018, and that was before Cianna was acquired by Merit. Now, you may still see SavvySCOUT referred to in literature. You may even hear colleagues mentioning SavvySCOUT. The thing to remember is whether you hear SCOUT or SavvySCOUT, it always refers to the same device.
The question we often get asked is, does SCOUT interfere with pacemakers or other implanted devices? And the answer is no. SCOUT is completely inert within the body until it is activated by the SCOUT guide or handpiece. SCOUT radar technology is a three-part system: the SCOUT reflector, the SCOUT guide or handpiece, and the SCOUT console. SCOUT is only activated when you use all three parts together. SCOUT operates on a completely different frequency to other implanted devices, such as pacemakers, cochlear implants, and neurostimulators, so there'll be no interference. Therefore, SCOUT can be used whenever without any compromise.